All right, welcome back to Pharmacist on Call, your 1 hour forum. This is Dr. Sean Pruitt, your community pharmacist. We're going to get right back into your calls, so it looks like we've got Nancy again. Welcome to Pharmacist on Call. How may we help you?
Yes, this is Nancy.
Yes, ma'am.
I have MS and cancer.
Okay.
And they recently prescribed me 50,000 units of D3.
Okay.
I'm wondering what might have caused that. They said they did blood work and I had hardly any vitamin D. And also I'm wondering about the hemp oil, if Medicare covers it, and how it helps with MS. I'm scared to death of painkillers.
Okay.
So they put me on something called diazepam.
Yes, ma'am.
It makes me very drowsy, so I'm wondering about the other.
Okay. All right, so let's address the vitamin D. Vitamin D is something that most Americans are chronically low on, specifically dark-skinned people like myself, because the melanin in our skin blocks the absorption of vitamin D from the sun. It's still the best way to get it, I guess, or other than milk. So we're going to have to do supplementation now. So usually your doctors will put you on 50,000 international units weekly, and that's something that, you know, certainly all dark-skinned people need to be on, but certainly everyone. And it is responsible for a lot of the issues with the thyroid are going to be tied, you know, eventually back to a vitamin D deficiency, our immune system issues, the prevalence of cancer, because the vitamin D is low. And so it is very important, even though we think it's just a vitamin and fairly innocuous, vitamin D, very important for everyone. I have to remember to take it myself. So that is why, if you want something to help boost your immune system and to help fight off cancer and even the flu virus during the winter, make sure you are supplementing with your vitamin D, and also some sort of iodine too. We're going to have a show on that, probably the next show. We're going to talk about iodine and vitamin D, some of the things that we're missing that could really go a long way to preventing and treating some of the worst conditions that we deal with. And these are things that have been removed from the food supply. But they need to be put back in some kind of way. As far as the CBD oil, I think with some of the painful issues that you're having dealing with MS, it also has a neuroregenerative piece to it too, so it can help regenerate some of the nerve damage that is done by MS and any other autoimmune disorder. What it does is it sends signals to your immune system to remodulate itself, and what you're going through with MS is the body is attacking itself, the immune system. What the CBD oil would do is get it to stop attacking itself and recognize it. Right now your body's not recognizing it as itself. It sees the body as a foreign invader. But the CBD oil is going to help it see that the body is not a foreign invader and stop attacking it. Do you follow me?
Yes, sir.
Okay. So yeah, I think it does have a role, particularly with pain relief. So if you have an issue with getting on pain meds, the hemp oil will just keep you from, you know, even having to go that route. As far as the diazepam, you probably won't need it either, because most of that is the worry about the pain meds. We're going to take away the need for it altogether, and so that's going to help settle you down. But the hemp oil also has a sedative effect as well, and it will help your anxiety. Do you follow me?
Yes, sir.
So yeah.
Does insurance cover that?
They do not. They do not. They do not cover any supplements, and that's what this is considered. And as I told the gentleman earlier, there is a form that is prescription. I'm not sure if it's been approved yet, cannabidiol, but that will be out on the market. But whether or not the government chooses to cover it will be another story. But as far as I'm concerned, the big win is here, because this stuff is over the counter and it's available if you can find it. You know, you just may have to spend a little money, but
what's the cost approximately?
Ours run anywhere from $19.99 up to $250, so it depends on the size. So this is our $19.99 size. This is our $250 bottle, strongest thing probably in the country for those of you really dealing with serious pain and health conditions. So it varies. So we've got 20, 40, 60, 80. We even got a hemp oil for your pet now. So we have pet hemp oil. So if your pets are suffering from arthritis and all these diseases, or if they're crazy when you get in there, they're full of anxiety when you leave the house, this will settle them down. Totally safe for pets, dogs and cats.
All right, well, thank you so much.
Yes, ma'am, you're welcome. Okay, let's see who we got here. Teresa, welcome to Pharmacist on Call. May we help you?
Yes, I'd like to ask you about something. I talked to you a few weeks ago. I was wanting to talk to you about, my doctor told me I had pancreatitis.
Yes, ma'am.
And I've had it for a long time. They told me that I had a spastic colon.
Okay.
And that's what I had. But it hurts so bad that I can't hardly stand it. And they put me in the hospital, you know, several times.
Yes, ma'am.
I know that you can't live, you know, they tell you that.
All right, so your issue is the pancreas or the colon?
The pancreas.
Okay,
But
so...
I have had polyp colon.
Okay, so let's make sure we're not eating anything that's going to aggravate the pancreatitis. So those are going to be sweets. Those are going to be fatty foods like cheese and all that other stuff that we love to eat. Those things are going to aggravate your pancreas, so let's make sure we're avoiding those. Second, let's look at, we're going to need to do papaya juice. Which there are enzymes in there that help you digest your food, as well as the beetroot juice. Also helps with that pancreas pain. And if it's really severe, it actually helps the pancreas heal and regenerate itself, which is how it helps diabetic patients. But also, let's look at the hemp oil too for that severe pain.
Oh boy, it's bad. It's really bad.
Yes, ma'am. This is bad too.
But when you said something about beet juice, I had a jar of beets in the refrigerator, and I got it, and I started eating them and drinking the juice.
A jar of what?
And drink beets, you know, homemade beets.
Okay, okay, yes, ma'am.
And I thought, man, I'll try anything, you know, to stop the pain.
Yeah, but sugar, remember, stay away from that and the fatty, greasy foods, because that's what really triggers that pain.
Sugar and fatty, greasy food.
Yes, ma'am.
No sweet. Then I've never been a sweet person anyway.
Okay.
I mean, I've never really cared anything about sweet.
Okay. Well, yeah, give me a call at the pharmacy. We're up on another break here. The producer's going to flash my information, so make sure you check us out, okay?
Okay, hon. Thank you.
Yes, ma'am. Thank you. All right, everyone, hold up. We are up on another break. We'll be right back.
Bye-bye.